Thank you very much. And do we have any substitute members for this meeting?
Stan Betty Butlin is substituting for David Vitti, Heather Dixie is subbing for Mark Callahan, and Stuart Gillian is subbing for Mark House.
Thank you very much. Thank you, Phil.
Just not a correction, but an amendment to that. So Betty isn't going to join the meeting, but I'm here instead of David today.
Thank you. Now, could I ask for, this is item 3 on the agenda, the election of Vice Chair. Could I ask for nominations for Vice Chair, please? Sam?
Thank you, Chair. I'd like to nominate Patricia Miller, the ICB Chief Executive, as Vice Chair of the Health and Wellbeing Board.
Thank you very much, Sam. Welcome, Patricia. Good to see you here.
Chair, could I second that nomination, please?
I was just going to ask you.
Sorry, jumping in there. I'm so excited.
It's fine. We need to get through this quickly. Don't worry. Thank you for seconding, Councillor Rampton. Are there any other nominations for Vice Chair of this board? No, I don't see any. Thank you. So I think we've probably, that's agreed then by everyone, is it? Any objections to that decision? No, thank you. So thank you, Patricia, for putting yourself forward and being nominated and seconded. Really look forward to working with you and hope to see you on board next time.
Yes,
I understand how busy you are, and this was quite short notice, so thank you.
Yeah, thank you. I apologise for not being there in person. I didn't appreciate that I had another commitment later on today, so I will definitely be there in person next time.
That's absolutely fine. Look forward to seeing you then. So we move on to item 4 on the agenda, which is the confirmation of minutes. And has everyone read the minutes, received, read and agreed? Are any comments or disputes about any of the minutes? No, not seeing any of those. So I'll sign those in a minute and they can go through. Thank you. So we have item 5, which is the declarations of interest. Does anyone have any of those to make before we start the meeting proper? Thank you. I think there are none. Public issues. Do we have any public issues, please?
There are no public issues, Chair.
Great, thanks very much. So we move on to the first substantive item, which is item 7, which is the strategic green space priority. Actually, what I should have said, does everyone know everyone? Because we've got a wonderful attendance here this afternoon. I'm very grateful to you all for coming. And I think there's definitely one lady who is smiling at me, saying, no, I don't know anyone. So would you like to tell us who you are, please?
Good afternoon, everyone. I'm Siobhan Harrington. I'm Chief Executive of University Hospitals Dorset. I'm pleased to be here.
Welcome. Lovely to meet you. Thank you. And I think, would you like to thank you?
Good afternoon, I'm Stuart Gillian. I'm the Group Manager for Dorset and Wiltshire Fire and Rescue Service for BCP.
Thank you. Anybody else who's new, perhaps, to the... Oh, yes, Dawn, thank you.
So hi, I know a lot of people already, but my name's Dawn Dawson and I'm the Acting Chief Executive in Dorset Healthcare.
So we're all happy that we know who we are. Welcome to new members of the board and also, of course, those who've been before. So, excuse me, Martin, we can now return to item 7, which is the strategic green space priorities. Please carry on. Thank you.
Thank you, Chair. So I'm just going to share my screen a second so we link everything up. So hopefully that is, yes, right there. Okay, thank you. Yeah, very pleased to be here this afternoon. So, yeah, my name is Martin Whitchurch. I'm Strategic Lead for Green Space and Conservation for BCP. I'll introduce Jana as well.
Hi everybody, I'm Jana Boyce. I'm a Project Manager within the Green Space team.
Okay, so we're here this afternoon just to talk to you about sort of our emerging green space priorities, if you like, and hopefully opening up a discussion conversation about the benefits of green spaces for health and wellbeing, and in particular some specific pieces of work we've been sort of doing over the last couple of years to really sort of formulate and take this forward. So I'm aware we've got a fairly short window, so we'll rattle through some content as soon as as quickly as we can, and hopefully have some time for some discussion at the end if that's okay. So over the last 3 years, we've been fortunate to have what's called Future Parks funding. So this is funded about £1 million worth of funding from National Lottery Heritage Fund, National Trust, and DLUC, and acting as one of a cohort of 8 places across the UK, really as sort of pioneers and innovators across green spaces work. And this is working closely with our charity partner, the Parks Foundation, who just work within BCP to improve open spaces. We've had funding already through Public Health Dorset, and Rachel, who's on the call, has been a huge supporter of our work across the last couple of years, so we're really grateful for that. We feed into the Local Nature Park Partnership and also the Stour Valley Park Partnership as well, which I'll talk about later on as well. So really this afternoon is about continuing support for green space improvements and innovation. I'm going to present the priorities today and consider opportunities with yourselves for that discussion. So very quickly, hopefully, I don't need to tell you this, hopefully this is well versed and well set out in national media, local context as well. There are huge health and wellbeing benefits of green spaces. There's a load of stats on the screen, I'm not going to read them all through. The one in orange, I suppose, is the strapline within that is what more can Dorset do in terms of those place-based interventions and making a difference for our local residents to improve their health and well-being through access to high-quality green space. That, in essence, is probably the challenge. As I'm sure you're all aware, a wealth of information and data internationally supporting the benefits of green space. But it's also with the lens, I suppose, of the climate and ecological emergency declared by BCP a number of years ago. Some of this is quite stark, but we're heading to a 6th mass ecological extinction event. Now that's kind of headline Daily Mail sort of territory, but it works. It got you all, a couple of people looked up, and it hopefully grabs your attention. Unfortunately, that is real and coming towards us at pace. The COP26 summit, we got the WHO 10 recommendations on climate change and health. There's Public Health Dorset has funded University of Exeter to do some leading research into accessible green spaces, and I know that's been presented here before, I believe. So it's about how we can embed standards and policy now to address this decline in nature, but also people's access to green space as well. So that's a bit of a banner waving moment, I suppose. And to bring this to what our priorities are as a green spaces team, last year we published and adopted within BCP our green infrastructure strategy, and that got challenged on that a minute ago. That is green and blue. Headline is the green infrastructure strategy. So that really sets out how we want to encourage healthy living and well-being in our communities, strengthen resilience to climate change, support nature recovery and biodiversity, and support economic recovery and prosperity. Now those are quite big targets and aims. And some of the work we're going to describe now starts to drill down into how we might achieve some of that. And that green infrastructure strategy has got a significant evidence base behind it. We did a stack of site audits of all our green spaces across BCP, got a range of case studies. But I think and there's a load of stats on the screen that you can pick out at your leisure. We'll obviously make the slides available. The big one, I think, for me is that bottom right hand corner. There's an average value of about £20 per visit to a green space by each individual. Now that's a big social economic value. That might be reduction, specifically for this afternoon, obviously reduction in cost of the NHS of treatment for obesity or asthma or depression or community isolation, all those things. And that natural capital report that we did, it's broad brush, there's some generalities in it. But I think as a figure, that's pretty tangible in terms of the actual benefits that our green spaces on the doorstep right here, the lower gardens just outside the front door, can make to all our residents. I'll hand over to Jana to do the next bit.
Great, thank you, Martin. So that sort of hopefully sets out our strategy and our policy and the evidence for why we do the work that we do and why we think it has some real benefits for the community. I'm just going to talk about some of the more specific projects that we're working on. I wanted to outline to you the partnership that we have with our the Parks Foundation. They're an independent charity. They've been going since 2015. They don't replace what the council does. They don't maintain the parks, but they do. They come in with additional benefits. They've raised 2 million in fundraising in the last 8 years since they've been going. They're just about sort of filling that space, doing that work that we can't necessarily do as a council, like I say, fundraising, reaching different residents. Public Health Dorset has and continues to fund them with certain roles where there's a direct correlation between what we can do with the community in our neighbourhood parks and health benefits. The foundation's really finding its place. It's not necessarily going to be running a restaurant in the Lower Gardens. What they're about is running community cafes. Winton Rec is a great example of that. Bringing in volunteers, small scale stuff in spaces that we can all walk to. We don't need a car to get to. The spaces that we've all loved over the years and in different times, taking our kids or ourselves. But maybe they're not the best funded spaces. They can look a little bit neglected, and they're the spaces where the Fox Foundation is doing a lot of work at the moment. They've been working for the last 3 or so years it started in our pilot parks, which was Winton, Waterman's in Somerford, and Alexandra Park in Parkstone. Over that time, they're averaging about 80 activities a year in each of our parks. So they started in those 3, then they took on another 8 neighbourhood parks across the conurbation when they got some extra lottery funding through the nature recovery projects on your screen now. Yeah, about 80 activities a year, all sorts of stuff: fibromyalgia groups, carer support groups, board game groups, Green Fingers gardening groups, stargazing. They get sold out. 100 people come and stargaze on a Friday night in Winton, and then they come back the next morning and they have a look at what moths were caught, and that's little kids and adults alike. Nature tots groups. So the activities are better when we've got a hub to work from. So in Winton we can offer more because the foundation runs the cafe there. But in the other 8 parks, Branksome Rec has got really good engagement with the community there. We took advantage of some of the flooding issues at Branksome Rec and created a wetland area. So some really interesting stuff. Another project that's coming up now is urban greening, and we were talking just before the meeting about what urban greening is about bringing nature to maybe some of the grayer parts of our conurbation. So we can't necessarily create a new park in some of those really densely grey areas, however much we might all like to do that. It's impractical for lots of other reasons, and there's lots of pulls on our spaces. But what we can do is bring some urban greening to those areas. So that might be street trees, it might be pocket parks, it might be green roofs or green walls, to bring nature to people where maybe their access to nature is limited at the moment. There's something called environmental justice that we're looking at, and colleagues, the Future Parks project is part of a national project that we were funded through the National Lottery and the National Trust. There's 7 other areas around the country doing this, and one other area is Birmingham, and they do some really interesting work around environmental justice. And lo and behold, areas that have poor access to green space, poor tree canopy cover, tend to have really poor health outcomes for different reasons. They tend to have really poor air quality. There's a correlation between some of these stats, and we want to use urban greening to address those. We don't have, unfortunately, a big pocket of money to spend on that, but we want to lay before you the evidence of why that's what we really want to do. The urban greening project will also work in community spaces as well, and that will be small scale stuff, addressing some flooding around our parks by implementing ponds or suds, green roofs, swift towers to address nature depletion. Green Heart Parks, that's a project that we've been working with the foundation on, so that's the council and the foundation working in partnership. Again, that goes back to our neighbourhood parks that I was talking about before. It's about looking at what we put into a park, so staff efforts, volunteering, really great resource that we already get a lot of and we want to do better at. donations and legacies fundraising, and then the green space economy as well. So I go and buy a coffee in a cafe in my local park. I need to know that the money that I'm spending there is directly financing the great stuff going on in that park. Maybe I'm being served by a volunteer, and that volunteer needs to know that his or her efforts are going to improve that space. And we know that what we get from that is a healthier community, a safer community, a community that's closer together and connecting with nature. Something that we look at around that is making spaces for girls. They're not always brilliantly addressed. Teenage girls within our parks, they're not all built for what teenage girls are after around. When they're asked what they want safe spaces. So they want that informal supervision, maybe of a cafe where an adult is, just not to be sat next to them, but you know, in the periphery. So our Green Heart Parks projects will open up cafes in those spaces and provide safe spaces for our youngsters to go, as well as all, you know, all members of the community. Yeah, just to quickly run through the Green Heart Park criteria. The foundation is going to be working on a project over the next couple of years. They've attracted 800,000 to work in. We keep adding spaces, it's really difficult not to, but we think we're on around 14 or 15 spaces, neighbourhood parks around the conurbation. They're small spaces, like I say. They'll be doing nature activities in those spaces, master planning them, so we bring in infrastructure benefits there that are good for biodiversity, community growing, cafe development, and I think that's quite an interesting stat as well, that 44% decrease in antisocial behaviour in Winton Rec since the cafe opened there. And on the days that cafe is open, residents tell us there's a buzz in the space, and a feeling of sort of being alive. Whereas you've got buildings that are shut up, it sets a tone. And we know why they're shut up. We don't have the resources to keep them all open in the way that we want. But the Green Heart Parks model is a model of paid staff, volunteering staff. So you don't need quite such a commercially viable cafe offer to be able to open up, operate, offer the activities I went through earlier, and yeah, create that sort of that feeling of openness and warmth, and put the park on a sort of upward trajectory rather than a slow decline, which I don't want to be pessimistic, but we will feel sometimes in some of our open spaces because there isn't enough money to go around everywhere. So that's just running through some of the smaller scale projects, but Martin's going to come back in.
Thanks. Yeah, and from that kind of, your local park on the street corner offer, the next slide that I just put up is the Stour Valley Park, which is a landscape scale partnership that we're looking at from Kingston Lacey, top left of the screen, and up in Dorset, down to Christchurch Harbour and Hengistbury Head, is about 25 kilometres of river corridor, a lot of it through pretty poor greenbelt and agricultural land, a lot of it in private ownership. There's about 40 different landowners through that length of river corridor, and what this partnership seeks to do is really bring together a common aim in terms of what that piece of land, what that corridor could deliver on a range of benefits. So there's a vision there that you can take in, and the concept around the Stour Valley is very much around access to nature, active travel routes, creating gateways and hubs for people to explore what is the countryside right along the long edge of our conurbation. Obviously meeting Dorset, and really speaks to a lot of the communities across BCP. This really could, you go out to somewhere like Throop, or you go into those sort of along the river corridor, you genuinely feel like you could be in the middle of Dorset, and yet you're a couple of miles from Winton town centre, or even sort of more dense areas. So we've partnering and closely working now with the National Trust and Dorset Council on this as a core partnership. The National Trust have funded a programme manager for the next couple of years, and we're looking now to take this project from what has been conceptual for good probably 12-15 years to bring to this point. The Future Parks project again allowed us the funding to develop that, and we'll share the web link at the end. We've now got a whole raft of strategic documents that are in place that really sets out the governance of the partnership and how we can translate this now into a delivery project. And we're looking now at how we sort of access those first kind of sort of the lowest hanging fruit along the corridor really, and opening up the new areas allowed for people to access and benefit from. So that's a whistle stop. If you've got a spare couple of hours, more than happy to go into this in more detail. What I'd like to do now is just summarise really where that brings us to, I suppose. So you've heard from us 3 key strategic sort of priorities and aims. So you've got those on the screen. So and that's hopefully what lodges with you today. Within those GI strategy, we've got that urban greening that Jana talked through, from grey to green. What, where, and how can we partner to create more of that? How can we generate more movement in being able to deliver that? Championing for stronger impact of green infrastructure. We think there's a rigorous and robust evidence base for the importance of this. So we want it to become a council and wider priority for cross-service work, embedding in the local plan. We're part of those working groups, but also crucially into new developments as well. How do we get this in front of developers so it's mandated that tree canopy cover is considered, that SUDs are considered, and all those other things as well. And then, as we talked about environmental justice, how do we try and mitigate? We know that climate change is coming, we know that things are going to get worse, so how do we start actioning that now? Our Green Heart Parks, we've got funding for the next couple of years to deliver those. In those couple of years, we need to try and find a way that embeds them and makes them less reliant on the funding bunny, as I called it there. Yeah, we go from pillar to post, just searching the next pot of money to try and make things happen. We need to make them more genuinely sustainable. Can we consider the Dorset green and social prescribing opportunities for that in accessing nature and our community parks? And then you just heard me talk about the Stour Valley Park as well, looking at that delivery partnership with our partners and taking that forward. So you might be wondering what we're asking for. What does all that get to? And it's sometimes difficult to know what to ask for when you're not quite sure what everybody else has got to bring to the table, I suppose. So this is why I said to Sam before we started that hopefully this is the first point in a discussion. Hopefully it's an opportunity to open up this as a conversation in terms of how we might take this forward. We're not saying, we're not sat here with a proposal today for X, Y, and Z in terms of funding or resource, because we know that's incredibly limited for everybody. So is it some form of agreement, memorandum of understanding around the people around the table, around the recognition of green spaces being good for health on a really simple level? Would that help? Would that help us in delivering our work? Would that help you in levering other things? Is it a joint strategy of some sort? Nobody wants another strategy sat on the shelf. But is there something around there that would help enable, I suppose is the question, whether it's the public health practitioners or others? That's your area of expertise that we're seeking advice and guidance on. Are there joint bids and support for funding opportunities, whether that's with public health research programs or funding for place-based interventions, whatever that might be? There's some funding live around that now, which is that link on there. And also the climate mitigation, environmental justice. How do we get prepared to mitigate future impacts for those most affected? I'm involved in trying to deliver biodiversity net gain. We're looking at green infrastructure standards for local plan as well. We're looking at green finance, so investment from corporate investment to improve habitats and biodiversity. So there's a range of mechanisms out there. I suppose what we're asking for, what we're looking for is that wider understanding of what else might be possible. So that's kind of our sort of pitch, I suppose. That's kind of what we wanted to present. There's some links, so sure Louise will send around the slides and stuff. Actually, we missed the video, didn't we? How are we for time? Have we got? Can I play a 90-second video, or would that be okay? Or we will move into Q&A and stuff.
I think that'll be fine, Martin. Thank you. We enjoy it.
Most kind. So how many am I going to need to go back into Teams? This is a test, isn't it? Yeah. I need to slick. So I'm still sharing. That's fine. That's fine. So we'll just go to there, and hopefully, we're not still sharing that. Okay. I might have to stop sharing and then come back. So let's stop sharing that. Come back into that, and it's that one. Okay.
Oh yeah, it's coming.
Is it coming? Have we got any sound is the question. And we need to do, hopefully I'll pick up through the mic.
As our towns develop, we have a vision to make getting close to nature part of our everyday lives. Our homes, buildings and streets can offer habitats for wildlife and resilience to climate change in big and small ways. By strengthening how our green spaces connect, we and our wild friends can travel healthily and sustainably. Our green spaces are important for our communities. We want them to do even more. Being places to meet and socialise, get a great coffee, exercise, play or volunteer, as well as supporting wildlife and addressing climate change. Some spaces will be close by in the neighbourhood and easy to visit regularly. They are the green heart of the community. Green travel networks can connect these places and even further afield. Time in nature improves our physical and mental health. A beautiful, natural, healthy environment makes a great place to live and work and attracts businesses to our area. Let's show the world and the Osprey what we're made of.
So I suppose we could have just played that. So that's, let me close that. Stop sharing. Okay, thank you. Appreciate your time. Welcome any questions.
Thank you very much, Martin and Jana. Really enjoyed that presentation. I think as a former farmer, as a former chair of Bournemouth Tree Wardens and current trustee treasurer of Friends of Boscombe Chine Gardens, I'm in accord with you. I absolutely agree with you that green spaces and the appreciation of those massively important to the health and well-being of our residents and communities. I can't speak for the board yet, but hopefully at the end of our question and answer session, we'll be able to assure you of our support. So I would like to ask questions. I've seen Karen's hand up.
Hello, Karen Loftus. I'm the Chief Executive at Community Action Network, CAN. So we have a long history of working with the Parks Foundation, great organisation, and we're really proud to work with them and support with volunteers and all sorts of things. We can also help with your funding bunnies. I've got a team that can help with that if you need any tracking down. I'm your woman, let me know. And also, just as a resident of Poole, I've been kayaking on the River Stour for many years, so fantastic that's even going to be better. So brilliant, that's fantastic. And my other thing was just to comment that, going forward, that actually getting communities involved and volunteers involved in green spaces is the only way it's going to succeed. Getting local communities to take ownership of their local green spaces is a sustainable model. We can go in and fix things up, but actually in order for a sustainable model for green spaces, enabling and empowering the local community, like with Boscombe Chine Gardens, with friends of groups, things like that, that's the way it's going to succeed. So thanks very much.
Thanks, Karen. Could I ask Dan to come in next, please?
Thank you, Chair. I could say a lot in response to this presentation, but I guess what I want to do is to try to set up that discussion that speaks to your final slide around this is the start of a conversation. And how do we want to take this forward as a health and wellbeing board? I think health and wellbeing boards are probably a board whose time is now, because we've got an integrated care strategy. One of the things that came through really, really clearly when we did the 100 Voices work, which was our public engagement, was just the value that people put on the quality of their green space and being able to get out into an easily accessible area. I'm really glad you made the point about the inequalities aspect of that. So I think what I'd invite members of the board to do over the next few minutes is to have a think about those challenges that Martin's put up, and perhaps we could put that slide up if it's possible, or people can refer to that slide in the slide deck, because I think this sort of work doesn't happen on its own. And I think actually you've done yourself a disservice, because Jana, you gave the impression that, this was all at risk and maybe it was perhaps starting to be at risk. But my perception, having lived here ever since 2003, is just what a fantastic job you've done in starting to think about new and innovative and creative ways of maintaining that investment, because certainly it's completely transformed the life that my two boys had. I arrived here with no children and they absolutely love some of the work that's been done. And I live on the edge of Kings Park, so I'm very aware of the work that's been done. But thinking about quantifying the health benefits, the challenge for us all is how can we continue to support this work. I was really interested in what you said about the potential for mandating the impact of developments. So as we think about mitigating the climate and ecological emergency, how can your expertise support developers to make the best of the realm that's outside of the public realm? Because the potential is absolutely huge. We've got a great foundation, but how can we make it even better? And it should be at the heart of our integrated care strategy. This is one area where BCP Council and Dorset Council can make a huge contribution to the health and wellbeing of the people. Thank you.
Thank you very much, Sam. Absolutely agree with that. It's really important. Jess, thank you for your patience. May I bring Patricia in next, please?
Thank you. So that was a really fantastic presentation. Thank you. And really supportive of the comments that Sam's made when we were talking to our communities around what they wanted to see in the integrated care strategy. It was really clear that the environment plays a really important part in thriving communities. And so there are a few things going through my mind. One is the fact that we should be doing it anyway. You ask us how we want to do it, but actually the Social Value Act is really clear on our responsibilities as public servants around creating sustainable environments, and that being hardwired into all of our decision making. So the first thing in my mind is, how are we making sure that we're fulfilling our legal responsibilities as individual organisations in the context of that act? Because I'm not sure that we are. How do we then translate that into the decisions that we make around service delivery and the wider determinants? And how do we hardwire that in as a really important consideration in all those decisions that we make? And then there's something in my mind around the really important value of the work we need to do at place and how we make sure this becomes part of the critical decision making at place. And that might mean us fundamentally changing the way we operate. It might mean us not giving planning permission for different things unless we're thinking about green spaces as part of that. But it needs to, for me, it needs to be a golden thread that runs through all of our decision making around service delivery. And it goes beyond green spaces. It's about keeping people active. And Siobhan, this will be music to Siobhan's ears, because Siobhan has some of the highest number of fractured hips in Europe, and the activity strategy shows that just keeping people active over a certain age can reduce that by 67%. So this takes us further upstream than just stopping people from falling. It's a really important part of how you keep people healthy for longer. So for me, this is absolutely critical to the direction that we need to go in if we're going to not just keep people healthy, but improve the quality of their lives and subsequently reduce the expenditure and the pressure on public service as a consequence.
Thank you, Patricia. I think that the point about prevention and early intervention is absolutely key, and I'm really glad you made that point. Jess, would you like to go next?
Thank you, and I'm glad Patricia made that point, because I was going to emphasise that the prevention and early intervention is absolutely key. I was going to do. I'll respond to Patricia on the planning. The green infrastructure strategy is absolutely critically linked to our local plan and being embedded into our planning policy. So there will be requirements through the development framework for people to meet, whether it's green roofs, whether it's green spaces, based on developments coming forward. So I think the council is playing a really proactive role in that space. I think bringing it back to sort of the health and wellbeing board, it's really important that we think about both the high level strategic space. So what are we as our organisations and together doing to support the implementation and embed that green infrastructure strategy? But also, where are the trials? Where are the things we can do on a small scale as well to test things? And that's where I'd look at people like the Parks Foundation, our internal team, actually what's going on in the hospitals now that we can use green spaces, use nature to really help people recover. So almost going at it at both ends of the spectrum, that really early intervention and protection, which is about us working with schools, it's about our communities, about people getting out and about into those green spaces and us creating new green spaces. But then at the other end of the scale, actually people that are recovering, recuperating, whatever it is, how we use nature to enhance that and actually test and trial some things in that space. And I think that's where I'd like, through the integrated care system, us to be thinking about that and how we can use our investments to test and things in this space, because there's a huge amount of innovative work going on. But let's us also be at the forefront of that, us being innovative as well.
Thank you, Jess. Yes. Karen, would you like to come in next? Manton. I think, oh, sorry, Dawn, you first. Beg your pardon.
Thank you. So I was just going to say I really enjoyed the presentation as well, and we've got lots of evidence that it's really important in mental health, and within some of our existing estate we've already created gardens and wildflower areas and things like that and planted fruit trees, and I'd be really interested in some of that work that you were just talking about, thinking how we could maybe get some projects together to demonstrate this. I think for me there's something around how do we pull this together into a coordinated work stream rather than us all doing little bits and pieces in our own organisations. But thank you, really enjoyed the presentation.
Karen? Yeah, thank you, Chair. I'm probably going to be a little bit contentious. Absolutely, thank you for the presentation, really enjoyed it, and who couldn't support that ambition and that work that's being done. But I think your first slide said about protecting nature, and I just wanted to sound a note of caution, because I think there's a danger of assuming that all green space has to be some sort of sanitised park-like space. And there's a danger that developers could see this strategy as a sort of a mandate for how all green space should be. And I'm thinking of one area in particular. And they seem to think that by putting up a bat box and a bird box and a bee hotel, and then there's a little pond, that's absolutely fine. We've got some nice pathways through and people can cycle. That's all great. But we need a mix. And some of our areas at the moment, which are green, are a bit wilder, a bit unkempt, but actually there's a value in that as well. And I just would hate for this to be seen as this is what BCP are requiring, this is how it's going to be, this is what if you're a developer, you can build something, which the instance I'm thinking of is where they want to take away a working farm and put more of a green space in its place. And I think that taking away something which is there with animals on it is doing our residents and their children a big disservice. And I'm also I'm really pleased that we've got the the requirement for 10% increase in biodiversity. I don't think it's always baselined, and that's a real concern to me as well. So I don't know if you can offer me any assurance, but I just wanted to make that point. Thank you, Chair. Thank you, Karen. Would you like to come back on that one, please? And perhaps a comment on others as well.
Thank you. Yeah, really, welcome all the comments. It's really useful discussion. I think to address that, I think baselining of biodiversity net gain is a challenge to start with. What's stopping a developer in year one clearing their land and then in year 5 submitting their application? And that's a challenge for our planning colleagues, but also within the framework and how we set up that policy and process as well. So I think we're still working out the finer detail on how we might do that. And yeah, absolutely, we need a range of open space, green spaces for all types of use. And the green infrastructure strategy absolutely mandates for that. So we need recreation grounds for people to play sport and be active and exercise. We need quieter spaces for people who don't want to be in the hustle bustle of their gardens, for example. And we need those community spaces. So absolutely, it's about a blend and a mixture of different types of provision, as well as increasingly making as much space for nature as we possibly can. And the nature recovery projects that Jana talked through were entirely about doing that. Where are the pockets? They were all, so a bit of detail behind how we came to those sites, I suppose, might help in that. We looked at the Dorset Environmental Record Centre data for the most ecologically, for the open space with the most ecological potential, i.e. they're the lowest performing sites currently. And we specifically chose those to go into to make those interventions. And yes, very mindful of a bird in a black box is fine. There's a time and place for those. We need to work a lot harder and make our green spaces a lot more open and accessible to do a lot more, to deliver a lot more than just some boxes that go on trees or corners of buildings. So yeah, I agree completely. If I just pick out one other comment, I think, just in terms of the one thing that sprung to mind, just looking at Janice, it's that early intervention and the prevention comment and the comment about number of hip replacements or whatever it was. Just sprung to mind, I did a project a number of years ago in Poole Park where we put some outdoor fitness equipment in the park, and we worked with Poole Hospital at that time and had contact with some great colleagues who really supported us in developing what we might put in. So I suppose what's leaping forward in my own mind is what would an open space look like that mitigates the most for the Natural Health Service? Yeah, for the National Health Service, what would it be? What would it look like in a range of interventions? We might not be able to put one in every park, but I suppose that might be a tangible piece of work where we can actually think proactively about what types of equipment for older people that might be useful, what types of benches do people like, you know, all of those practical interventions that might guide some of that sort of capital delivery work that we do. So just a thought on that straight.
Thank you, Martin, and that will bring in Siobhan.
To say it was a great presentation, and I've not been in this part in Dorset for that long, and was in Archway in North London before. So actually, to see all the opportunity of the green space, this has just really consolidated all of that in my mind. And if I think of UHD, I mean, all of us as health and social care providers, there's not only the community impact, but there's also the impact for our staff. And I'm just struck, you know, Royal Bournemouth's got we've got a lake and we've got gardens that people have, the staff have sort of developed themselves. And that is such a nice model in terms of community engagement. And then, as you say, Poole Park. So at the moment, it feels, if I'm honest, quite disparate. And actually, this is an opportunity for us to bring all of that together. So really, really keen to be involved. Prevention, population health, you know, this is something that I think as hospitals, we need to be hospitals without walls that actually support communities that get involved in what you're describing. I suppose one of my challenges back is what are our measures around this? So I think we should think about that. And also memorandum of understanding, if we need one, then obviously it'd be great if it was broader and involved all of us.
Thank you, Siobhan. That's really excellent points that you've made there. And so I think the general consensus is that absolutely we love all the work that's going on. We understand that there are parameters and there are problems with funding always, and that our support in terms of partnership working is really important, and we must try and do that as far as we can. The points that have been made, I think, will come out in the minutes so that we can review those, and perhaps we can bring this back later on to show what we think we can do in the future.
I think just as an interim suggestion, Chair, we're going to take a paper, it's either agenda item 9 and to some extent agenda item 10 touches on it, which is about the forward work programme for the Health and Wellbeing Board. I think both of those papers are recommending we spend time as a board thinking through the implications of the integrated care strategy, and out of that develop a clearer work programme going forwards, and that's where I think it'd be useful to pick up some of those recommendations that come through in the minutes.
Thank you. That's a really good point, and we'll do that. So thank you both so much for coming. Really appreciate it. And I think so we need to note the work being undertaken by the BCP Council Strategic Green Spaces team and thank them for it. And consider opportunities for further partnership working that improve the spaces and make a difference for our residents, because that's what it's about, isn't it? We're trying to make a difference both in their own sort of day-to-day health and well-being, and also for you know, larger issues such as Siobhan outlined. So yes, that's great. So that's thank you very much. Okay. So we can now move on to item 8, which is the Better Care Fund. I think Phil's going to be talking to that. Thank you.
Good
Good afternoon, and for those that don't know me, I'm Phil Hornsby, Director of Commissioning for BCP Council. This report originally came to Health and Wellbeing Board in October, but we weren't quorate, so we're having to bring it back today, but we're definitely quorate today, so that's fantastic to see everyone. The Better Care Fund was the government's drive from 2013 onwards to bring health and care together and join up funding to pool it into a single fund that addressed key issues that were important to both health and local authorities. This national guidance comes out every year. It hasn't changed much since 2019, mainly driven by the fact the pandemic came along. We do expect it to change for the coming year. So we did develop a joint plan, and that's one of the key elements, developed jointly with NHS Dorset, but also the key partners, including our other health partners across BCP area. So there's minimal change to the plans that were received by the board the previous year, but I just wanted to spend a couple of minutes picking out some of the key points because it will be new to some members of the board today. So the key requirements of it is that we complete a planning template which sets out the money that we're going to spend, what we're pooling together, and then a narrative plan which describes the actions and the activity, the work that's going to take place over that year. And that's attached as an appendix, and I don't intend to dwell on the details of the appendix, but the new thing this year was a capacity and demand template, which was trying to understand across the whole of our system, and bear in mind that we also work very closely with Dorset Council, because the NHS Dorset footprint is across both council areas, around what is the capacity and demand we have to meet the requirements of supporting people safely out of hospital and continuing with their care and support needs in the community. The conditions around this is that we jointly agree the plan, and that includes taking it through a number of governance routes, which includes sign-off by the chief executives of BCP Council and NHS Dorset, which did happen, the Joint Commissioning Board, Dorset, and coming ultimately to the Health and Wellbeing Board for final sign-off. We have submitted the plan already, and we had to submit it by back end of September. NHS England have been chasing us ever since to know when we've got it signed off here, so I am hoping that the board can agree today to sign off and approve the plan. And then the final part I just wanted to say is that there's approximately £64 million worth of funding joined up in this Better Care Fund plan. Some of that's specific grants from government that come direct to the local authority that we're mandated to put into the pool. Others is a minimum amount by NHS Dorset, and NHS Dorset put above the minimum amount into the pool fund. But it doesn't stop us in the future from putting additional amounts into the fund if we can identify the resources and produce even better outcomes for the people of our communities. So I'll pause there, Chair, for any questions.
Sorry. So do we have any questions or comments? No? Okay. Anyone else? No, I don't think we do, Phil. So I think you've obviously explained that very well. So we just need to approve the Better Care Fund plan for 22-23, taking into account the investment and delivery plans as outlined, and as Phil has described. So we do need to actually vote on this one. So should I have hands up for everyone who's agreed? Yep, everyone. No objections or dissent. Okay, or abstaining or anything. Great. So I think that's we're agreed on that, and you can continue, Phil. Thank you very much for that. I know there's a lot of work goes into it, so I appreciate that. Thank you. So now we can move on to item 9, which is about the integrated care system strategy and next steps. And that'd be Sam speaking to that, please. Thank you.
Thank you very much, Chair. So I'm really pleased to be presenting this item. This is a paper which introduces to the Health and Wellbeing Board our first integrated care strategy, and you'll see that that's been included as Appendix 1. I wasn't intending to talk today in a huge amount of detail about the content of the strategy. The main point of the paper is really about asking the board whether the board would support the recommendation, which is that we spend some time as a board in the development session working through in a bit more detail the implications behind the recommendations in the integrated care strategy and what that will mean in the context of the work of the health and wellbeing boards. The three high-level objectives in the integrated care strategy are about prevention and early help. That's a really important theme. Enabling communities to thrive. And then the third objective of working better together is really about how we join up care around people and place. The health and wellbeing boards are not formally required to approve the ICS strategy, but the relationship between the board and the integrated care system is going to be really important as we start to unpack the strategy and understand what it means. There is a requirement, however, for health and wellbeing boards to comment on the extent to which the integrated care strategy reflects the priorities of the health and wellbeing board. So there's sort of circularity going on here. We've got an overarching framework for the integrated care system, but it's important that the board is very, very clear about the particular priorities that chime most with its own joint health and wellbeing strategy. And most importantly, its statutory responsibility to produce a joint strategic needs assessment. So that remains a key responsibility of the board, and it's the way that we capture the data and the evidence and the views of residents about the issues that are most important in our place. So I don't intend to talk too much more. I'm happy to break into questions and a discussion, but I hope that the board would be supportive of finding some time so that we can consider the strategy in more detail and then think about the relationship between what the strategy is asking us to do, the priorities that emerge from BCP Council when we think about the place and the joint strategic needs assessment, and then above all, what we would want to reflect back in our joint health and wellbeing strategy, which will need to be refreshed over the next few months. So I'm happy to break there and take comments and questions.
Thank you, Sam. Do I have any comments or suggestions or questions? No, not at the moment. I just wanted to say that I feel that you're absolutely right. We need to talk about this further at our development session because the health and wellbeing strategy, we must refresh it and make sure that it is relevant and applicable to current circumstances, particularly where we have the start of the ICS and the ICB and the ICP that we are all working towards. Partnership working being of the most importance at the moment. So I'm not seeing any. Patricia, did you want to come in? No, not at the moment.
Yeah, I can say a couple of things. I'm for leading the process because that's been really important. And it's been really important that the strategy has been seen to come from the right place, that it shouldn't be health dominated. This is about a real genuine partnership between ourselves as health colleagues, local government, the third sector and the private sector, because none of us can improve the well-being of our communities by ourselves, by any individual organisational action. And it was also really important that it didn't sit with health, because we know that health can only influence 20% of anyone's health and well-being by the interventions that it takes, and this is a much broader ambition. So thank you to Sam for leading that work, and also it was really important to Sam and I that this was driven by the community and their needs and their experiences, not by us as officers determining what they need. So the next step is really important, how we turn the strategy into action and really start to see some change for our communities for the better. And that's not just about longer, healthier life expectancy. It's about longer, healthier, happy life expectancy in communities that thrive. And we've all got a part to play in that. So I'm really looking forward to the next phase and how we start to be able to evidence that what our communities have told us they need is what we're delivering for them and with them.
Yeah, thank you, Patricia. You're absolutely right about that. Really important, that next stage. And that our communities and residents are supported in their needs for the health and well-being. So that's fine. So I think what we need to do now is to note and support the ICS strategy as a broad framework for securing the fastest possible improvements to the health and well-being of residents, which I think is what we've just said really. That we agree to consider the strategy in detail at a development session to help develop the work programme and the refresh of the joint health and wellbeing strategy, focusing on the priorities most relevant to BCP council population. And that we note and support the next steps in implementing the strategy as agreed by the ICP. So do I have assent and agreement across the board for those things? Yes, I think I do. No objections. Great. Thank you very much, everyone. Martin and Jana, I didn't say you're absolutely welcome to stay, but if you've got more pressing things to do, then we understand if you prefer to leave. But, you know, it's up to you.
I particularly want to stay for that bit because how
Thank you.
interesting it is,
Well, that's
and
great.
you look at all the bits of it and you feel like that's partly us too, isn't
So
it?
pleased you're here. Thank you.
So, might
Okay.
move now.
Thank you.
So now we're on item 10, which is the last item on this agenda. And this is about developing the work programme for the Health and Wellbeing Board, which I think Sam had alluded to earlier. So would you like to speak? Thank you, Sam.
Thank you, Chair. I'll just make a couple of very brief comments, but then I'm going to invite Sarah Longdon, the Head of Service Planning from Public Health Dorset, to talk about the paper in a bit more detail and Sarah's ideas about how we bring it to life. So to some extent, this paper goes hand in hand with the paper that we've just received, but I felt it's important that we had a separate paper on the strategy, and then we start to get into some of the implications of the changing roles for boards. So that's what this second paper does, is it tries to set in the context of the new legislation how the additional responsibilities coming to health and wellbeing boards will shape the future work programme of the board. So I'm going to hand over to Sarah. Thank you.
Thank you, Sam. This is Sarah Longdon, Head of Service Planning, Public Health Dorset. So Sam's already introduced the purpose of this paper and very much follows on from what we've just heard about the integrated care strategy. So an opportunity at this point in time for this board to have a think about its role and its purpose and understand the changes of that in light of the developments and the integrated care system taking shape and coming forward, particularly with the strategy now set out. So the role of this board in light of that and how everything knits together. So I think it sounds like we're all in agreement that a development session will be very useful to explore this and really be clear about how we make that happen. So the paper sets out some information about background of this Health and Wellbeing Board, but there are a few changes to that now. Now that the ICP and the integrated care system is set up. So paragraph 5 just sets those out, new responsibilities. So to review the integrated care board forward plan, which is the NHS delivery of the integrated care strategy, to be consulted on ICB performance assessments by NHS England, in the contribution made to the delivery of health and wellbeing strategy. So we've talked about reviewing the joint health and wellbeing strategy in light of now having the ICP strategy. Sounds lots of acronyms there, but I think it is really important that the Health and Wellbeing Board is clear on what it's here to deliver and be responsible for, and then how it contributes and vice versa to the wider system piece. So I think that would be some time well spent to explore that. So also in terms of new responsibilities for the Health and Wellbeing Boards and the Integrated Care Partnerships and the ICB to determine integrated approach to deliver streamlined care and prevention activity at place. And I think that's an important point, at place. There's been, we're having conversations about what that means to be the place-based responsibilities for integrated health and care. This board exists to do that, to look at that, to be responsible for that. So we just need to understand what that means for the work of this board going forwards and those new responsibilities. And then lastly, one more responsibility to review the ICB annual reports. So a few changes there, very much in light of the developments of the integrated care system. So I think we, as I say, we are in agreement. I think that we need to explore that. And just further down in the paper, there's just a diagram just setting out where the Health and Wellbeing Board sits in relation to those entities. So we've got the ICP strategy, I see it at the top of the tree, which covers the whole system, so that those big overarching strategic objectives, as Sam's outlined just now and we've just seen in the paper. So how the Health and Wellbeing Board complements that, contributes to it, and takes some responsibility for achieving those overarching objectives. And equally, we need to look across the relevant strategies across the whole care system, how they knit together, who's responsible for what, how they feed into each other, so that we are not confused and we're not overlapping, duplicating, that we're complementing and working together, and there is some consistency. And so in light of all of that, understanding the overall integrated care strategy, thinking about what an updated strategy for this Health and Wellbeing Board needs to look like, what it needs to include, and then out of those two pieces would then come a work programme of business for this board to consider and agree, such as what we've just been hearing about the green spaces. A good example of how some could be through this board, some is wider as integrated care system, strategic objectives, and then what we do and what we can ask others to do for us.
Thank you very much. That's really helpful and absolutely what we need to do. I think the comment in number 6 in this about developing place-based work, because we must understand what place-based actually means. Is it geographical, or is it to do with demographics, or what is it to do with? And the other thing is about that I think is important about not duplicating work, and I think it would be quite useful at some point that we could get together with the Dorset Health and Wellbeing Board to kind of thrash that out a little bit, to find out what our joint responsibilities and roles are as opposed to those separate ones, because we are very different places. And there you go with the place-based stuff again. So yes, there's a lot to be done, and I think looking at our strategy in comparison to the ICP strategy would be very useful as well, to develop it in that way. So do I have any comment or question? Do we have Jess? Thank you.
Just a question for clarification, actually. We've got the ICS place-based workshops coming up. Is everybody that's in the room here at those? I'm just wanted to understand the overlap, but also the opportunity that creates in terms of us then also doing a workshop, and just how those things can interrelate.
Hello everybody. I didn't introduce myself at the beginning. I'm David Freeman. I'm the Chief Commissioning Officer. I'm an interloper today. I hope that's okay. I was talking to Phil, and we knew this was coming up, and some of these items on the agenda would be good for me to come and be part of. I can answer your question, Jess, actually. So I'm taking the lead for place-based development work on behalf of the ICB, but on behalf of our systems. And we are working to pull together what we're calling design workshops, which is really bringing multiple partners together from within the BCP footprint, and a similar one of the colleagues here who are sat here today will be involved in those conversations to try and help with that design. But we're just facilitating those conversations. We don't have any preconceived ideas about how that will work. Although I do have one personal view, which is that I think the Health and Wellbeing Board should be the governance, or part of the leadership governance for the place-based ways of working. But that's for us to decide and determine within those conversations.
Thank you, David. Does that answer your question, Jess?
Yeah, what I'm just thinking about is how we can capture what we talk about those to make sure we're feeding them into any development thinking we're doing here. And I think Sam's probably got the answer.
I definitely don't have the answer, but I have a suggestion. Just picking up on David's point, the paper also makes the point that we changed the constitution of BCP Council in November 2022 to make that subtle shift to recognise the Health and Wellbeing Board as the strategic leader, if you like, for place. When the guidance came out around integrated care systems, I was a bit confused, I'll be honest, because it talked about place-based partnerships, but it's Health and Wellbeing Boards. And we've already got a statutory place-based leadership board, which is the Health and Wellbeing Board. But what we do need to do is to make sure that we're clear when we're operating at the different levels. So I think some of the place design workshop work is thinking about, if we're going to come together and deliver, then how do we do that? And how do we make sure that we continue to understand what are the right things to do? But it doesn't take away the Health and Wellbeing Board's role as the place leader, articulating what's really important to our residents and communities and drawing on the Joint Strategic Needs Assessment to inform that. So that was the way that I saw it, and I hope the board would support that.
Thank you, Sam. Okay.
Sorry, I guess I was being a bit more practical. Because I get that. I was just being a bit more practical, thinking, we've got that workshop, let's make sure, how do we make sure what's achieved at that workshop then feeds into the Health and Wellbeing Development Board on a very, literally on a practical note. I'm thinking, you know, let's get the notes from that and feed them in so that we don't end up duplicating. That's a very practical thing of trying to join them.
Yeah, so I now see what you can. Well, because it might work, because the hope is that we can have the place development design workshops, at least the first round of them, before the end of March, and maybe even mid-March properly. So if we could have that work, and that might feed into a conversation, Health and Wellbeing Board development session, and then the outputs of that feed into the next round of workshops for the place. So it becomes a virtuous cycle of conversations.
Thank you. Patricia, I think you have your hand up, yeah?
Yeah, there's something going through my mind is whether there's an opportunity to combine the two, which I think is where Jess is going, David, around combining the workshop series that we've got set up and the Health and Wellbeing Board feeding into that. And I think the other thing we need to think through is, as that work starts to evolve, how do we provide a regular briefing up to the Health and Wellbeing Board around progress? Because it's really important that the HWBs are seen as the decision makers and the group that holds the place operational delivery to account on behalf of the Integrated Care Partnership. And so making sure that you're in the loop as an entire group as to where the development is going, and when we make some recommendations around final go live is going to be really important. So I don't know if we could take that outside, David, and just think whether we could combine the two if possible, unless it's a bit too short notice.
Well, other than we were already trying to target members of this group to be part of that workshop, so it's whether the whole of the group wants to be involved or representatives from the group to be involved to make that work. So we can take that offline and just, if it's not sufficient, then we can change it.
Okay, thanks.
Thank you. That sounds like a practical outcome. And Sarah.
Thank you. A useful comment. So I think I would just add that I think it's how we see the work of the place-based partnership and the Health and Wellbeing Board. They're two parts of the same thing. I think if we can see it in that way, and the workshops would be, you know, a subgroup of the development of this board and the new responsibilities and the new work programme. So it's all feeding into the same thing. I think that's, if we can see it in that light, it will help clarify.
I'm still being asked by people, they hear the word place a lot being said, and I get up, what does that mean? What does place mean? Has that been bottomed out yet, what we mean when we say place? Because we're saying the word a lot, and I will be asked by my board of trustees next week, what is that an actual physical place, or is it still being, are we still going to have conversations and work that one out? It's quite tricky, I know. Sorry, horrible question.
I think we're still working it out, actually, Karen. I think some of us know what we would like it to mean. Maybe others have different views.
I was just going to come in because I read, I can't remember which strategy, somewhere around the place-based work that's been done, and I think it was from PwC. They've actually set out that challenge a bit. One of the decks of slides have been sent around at some point, and it does just do that challenge of, if you're in the local government, you might think about it like this. If you're in the voluntary sector, you might think this is what place means. From an NHS perspective, this is potentially what place means, and then trying to say, well, actually, the neighbourhood level is where actually we're all coming together, and it is set out quite well. But I'm over to David because he probably holds that information.
No, you get it perfectly, and it's to what you're saying as well, Chair. Around it's there for defining and co-designing. It is. I was going to say the use of the word place is a placeholder. I mean, there is a geographical boundary to it, and that is the footprint of the BCP Council and the Dorset Council as the two separate entities. But beyond that, it's for us to determine what we mean by it. But actually, I think your point, Sarah, around it is the Health and Wellbeing Board, effectively. This is what we're trying to design, if everybody's supportive of it anyway, is the operational arm of the Health and Wellbeing Board to try and make that strategy, that work happen. Absolutely.
Yeah, I think what you just said is what I would believe, that let's keep it simple. We've got BCP and Dorset councils, those local authority areas already set out, which together cover the whole of Dorset. Let's stick to that, because they, although there are differences in between those two, there are some synergies, but they are different places, and BCP is essentially far more urban and Dorset essentially far more rural. So, you know, it just seems to me, why are we, you know, reinventing the wheel when we've got one already? So thank you. So if everyone's happy with all of that, I think we've come to the end of our, oh, Patricia, I do apologise.
It's fine. I was only, David got in, was just going to say that the guidance says that place is coterminous with local authority boundaries, so that makes it really simple. I think we've got a bit of work to do in health, because the way we view neighbourhoods and primary care network boundaries is not the same as the democratic boundaries, and there is something about trying to align some of that. But what's more important is, for me, is not necessarily the definition of place, although that the current definition makes it easy for all of us in terms of understanding the working relationships. Where the real change happens is at neighbourhood level, and that's what we need to focus on, really making real change at that level, where communities identify with others rather than our local authority boundaries.
Thank you, Patricia. Yes, that's wise words. Okay, is everybody happy that we are now at the end of the agenda? Anybody have any other business to put forward? Nobody online. So I'll finish the meeting at 3:15. Thank you very much, everyone, for coming. Very helpful.